Now, ladies and gentlemen, it's an interesting topic that we are going to have on stage right now, which is how to run a sustainable and profitable clinical practice. Are you all ready for this? Where are all the doctors in the house? How profitable or not so far? Tak ada bunyi pun. Profitable or not so far? Okay lah, that's why we are here lah, to learn how to be more profitable and so on. Ladies and gentlemen, please put your hands together. Welcome on stage, Dr. Junaidi Ismail from Qualitas Health Malaysia. Dr. Jun? Hi, welcome.
Good morning, everyone. Well, I was quite concerned when I heard the response about when the MC asked whether your clinics are profitable or not. Okay, because that's a gauge of how difficult my work will be for the next 25 minutes. But anyway, before I even begin, can I understand amongst those in the audience, how many of you actually run a practice today? Can I have a show of hands? So, local covering right now lah. How many of you are aspiring to open a clinic? Anyone? Okay, great. How many of you have run a clinic and have given up? Anybody? Okay, well that's good. But then we got a lot of empty seats here. So I don't know, maybe those guys have left. Okay, so I have only 25 minutes. Now, to be honest with you, this is not a topic that can be covered in 25 minutes. Okay? Because I'm from Qualitas Medical Group, and I can tell you this is a topic that we discuss every day. Every day. Why? Because there are so many challenges today. Every day you wake up, you open your phones, and there's something new that you have to comply with. Betul tak? Apa lagi? E-invoicing, SST, apa lagi? Mandatory drug price display. I don't know what else is going to come. Right? So honestly, I'm happy to see that I think we have the various, how do you say, age groups within this hall. And I can assure you, I think the amount of experience that we have in this hall is a lot. But what I can say is this lah. When I was a child, when I was a kid, 45 years ago, my parents would take me to a GP practice in PJ, and you know what, I would look in wonder and awe at the doctor. Pakai BMW, kan, rumah besar, right? And he was smiling all the time, because he didn't have to go and comply with all these many things. But I think today is a different story. So trying to run, I chose the word sustainable lah. Initially the topic given to me was profitable. I think the more appropriate word is sustainable. Okay, why? I'll share that with you in a while. Because as you know, Qualitas, we've been around for 25 years, we grow by acquisition, and we've come across a lot of examples that we'll share with you as we go on. Okay. My clicker doesn't seem to work. It's not working. Okay, so I'm not going to bore you with statistics, graphs, charts, words, novels on the slide. Very, very simple. It's just for decoration. Yeah, listen to me lah, I will explain. Yeah. The main thing you've got to think of, whether you're still running a practice or whether you're about to start a practice, is your finances. You have your understanding of a financial requirement of running a clinic is extremely important. 20 years ago, I opened my clinic without even a single knowledge of accounting. But I was still able to survive. You know, by sheer luck, we could survive those days. But today, if you do not have a basic knowledge of accounting is going to be very difficult for you. Now, why do I say this? Because we've seen a lot of it. We've seen a lot of it where, doctors start off a practice and then 6 months later, they run out of cash. They can't afford to pay their staff. Electricity pun tak boleh bayar, rental pun tak boleh bayar. Okay, memang nampak gas buka klinik. Looks nice. You feel good that you are running your own practice. Right? You pay your staff. You hire, maybe 4 staff. You want to run 8 to 10. So maybe you take in a second doctor for locums after office hours. Suddenly, and then you buy ultrasound. You buy X-ray machine. You open up in the funkiest of places. You spend $500,000 ringgit on your renovation. 6 months later, everybody's knocking on your door. Where's my money? This is the main issue that we see in a lot of practices. 6 months, 1 year, tutup kedai. I don't want to give names, but I'm sure within this group, some of you know another problem that results in cash flow deficits is this super ambition to grow. I want to have 50 clinics in 2 years. What happens? Because I've got one practice that does so well, thriving, profitable, let's grow to 50, go for IPO, become a millionaire, leave. What happens? You start opening. By the time you open your 7th clinic, that one clinic that is profitable is not generating enough profits to maintain the other 10 clinics. Then what happens? Belum raya, orang komplain dalam Facebook, gaji tak bayar. Cash is king. Now I sound like an accountant, unfortunately, but it is a fact. Cash is king. Now why do I say this? This sound financial knowledge. We have seen many clinics in their accounts sales bagus. 50,000, 80,000, 100,000 a month sales. Tengok dalam bank tak ada duit. Dalam bank tak ada duit. Kenapa? Because people forget. TPAs take 90 days to pay. Sometimes you bill them 10,000, they only pay you 7,000. Am I right? I see people nodding. Some people don't even pay you. The nod is even bigger. Right? So cantik lah, sales cantik. Tapi duit tak ada. Duit yang penting for you to pay your staff, to pay yourself. Right? So, it's exactly that. Your cost discipline needs to be very important. We cannot go into the open the till and take money out as we like. Tak boleh. Even though you're the owner, my advice is do not do it. Why do I say that? Because when I was running my clinic, I did that. But luckily, I realized soon enough that that was a highway to a lot of problems. Suddenly I realized, after a few months of doing that, I realized that I didn't have cash to pay. Although my sales looked good. Okay, we see a lot of clinics today, young doctors, they buka clinic, they spend 1 million on their renovations. Cantik. Berkilat clinic. Patient tak ada. Right? So please, you have to have very, very sound financial knowledge. Now the next thing that we tell our doctors as well, today, gone are the days for you to run a practice based on cough, cold, and selling of medication. You cannot expect to thrive. In fact, you can't even be sustainable today. If you are going to base your business, your clinical practice, solely based on medicines. I know some of you, might disagree with me, but let me tell you this, as far as I personally see it, dispensing separation will come. And actually, dispensing separation has come. Do you realize that dispensing separation is already here?
Yes.
Correct? Yes. It's just not official. It's just by market forces today, it has been separated to a certain extent. If you are about to start a practice and you're going to base your business model on sale of medication, how much profits I'm going to make from medication, my advice is don't open the clinic. You need to have a diverse flow of revenue. And as the next few years go by, your dependence on medication must be less and less and less. Now, how do you do that? Many of our colleagues have started things like aesthetics. 10 years ago, occupational health was a big thing. Today, every other person you throw a stone, you will hit an occupational health practitioner. Tak boleh dah. Aesthetics, forget it. Right? So, you have to find your niche. What is that niche? I cannot tell you. You need to look in the mirror and ask yourself, what is my niche? But ideally, that niche should not be something that is already being disrupted by technology providers, by other stakeholders within the industry, healthcare industry, by businessmen who have no knowledge of how to run a business, clinical practice. Right? You need to find that niche where no one can touch that particular service. No one can compete with you on that particular service. What is it? You need to ask yourself that question. Some of you may have very strong surgical base. Maybe that's something you want to look at. I'm not asking you to do laparotomies in your clinic, but there are many office-based procedures that you can go into. Now, on this note, I just want to point out that there is this misconception, right? A lot of people, sometimes when I talk to senior doctors especially, they say, mana boleh, tak boleh buat TPA tak bayar. Actually, that's the wrong perception. I'm not here to represent anybody, but I just want to advise you that go back if you are with TPAs, really study what is it that they allow you to do. And you will be surprised to find, if you didn't know already, that some TPAs actually pay you for office procedures. It's just that we don't do it. Okay? And finally, this is adoption of technology. I just want to put a word of caution here. We are so enthralled, so excited, when all these providers, these so-called disruptors, they come to our clinic, they say, why don't you use this? Why don't you use that? We have this, we have that. All kinds of things that they will offer you. My advice, you can listen, but my advice is this. Just pause and ask yourself, if there is a cost, how do I transfer this cost to the patient? Are you merely adopting technology for the sake of it, for the beauty of it, but how is it really helping you financially? Is it going to make a difference? Can you charge the TPAs for adopting technology? Cannot. Will your cash-paying patients pay extra because you email them an email, a receipt? No. Can you charge more than 35 to a patient because you have e-invoicing? No. Then, macam mana? You're just adding cost, and what is happening? You are eroding your profits. Right? So, ask yourself first before you adopt technology. How is this going to benefit me financially? There are others who say, I have AI this, AI that, AI that. Fantastic lah, AI. But can you go and charge the person 5 ringgit more because you have paid the AI provider 5 ringgit more? Can I? Tak boleh. So, you got to think. Be careful as to how you want to adopt technology. Okay, so fast, 15 minutes already. Okay. Now, everybody carries the same set of medications in their clinics. I think today, if you compare notes amongst everyone here, you will be carrying almost the same set of medications in your clinic. So how are you going to differentiate yourselves with the 10 clinics along the same row? Today, guys, that's possible, isn't it? Those days, one row, one clinic. Today, one row, 10 clinics, 5 clinics. So how do you differentiate yourself from the next person? If you ask me, it's about the quality of care that you provide. You know, I see a lot of corporate clients, HRs, right, regularly. And, you know, they always come up with this thing about, doktor tu tak sentuh sangat lah. Not friendly lah. Now, I'm not saying that you guys are responsible or, how you say, to be blamed for that. No, I'm sure you're good doctors. But here's the thing, when you open a clinic, because of work-life balance today, kita nak balik pukul 5. Then we hire locals. Right? Some locals are very good. But there are some locals who just finish a 12-hour shift. Then they come to your clinic to sleep. I'm not blaming locals, but you know that I'm sure we've all done locums and we've all been in the same boat. So this is another area. You have to really ensure that there is continuity of that quality of care in your clinic. You want the patients to associate your clinic with quality, not you alone. What I'm trying to say is, you don't want patients to say, lepas pukul 5 jangan pergi klinik tu. Sebab lokal tak bagus. So, you have to ensure that that quality of locums is very, very strong. Those days, you know, when I did a bit of locum, actually I did a lot of locums those days. If I was a new locum, there were some doctors who would sit in the clinic for 1 hour in the room next door, listening to how I manage patients. They would come back the next day and ask the nurses to give him all my cards, all the cards that I saw patients. They would review those patients. If they found anything wrong, they would speak to me the next time I went for locums there. How many of us today do that? See? So, be careful. But you need to ensure that the continuity of quality of care must be there. You must be there in your clinics. You must be associated with quality. Okay? Sorry, I missed this. And when you do that, that's when you get loyalty. You know, there's this word that businesses use. It's called being sticky. Tahu, being sticky. You know that paper that they use to tangkap lalat? You know what? The one yang bila lalat hinggap, dia tak boleh terbang. Melekat kan? Melekat. You need to be that kind of paper. Your clinic needs to be as sticky as that. Because today, if you are not super sticky like super glue, they can just walk to the next clinic, or the next clinic, or the clinic behind. Now, how to be super sticky? That is something entirely up to you. I'm sorry if I have to touch on this, but it's about your personality as well with patients. Patients need to feel that, you know, I keep telling my colleagues, my friends in Qualitas as well, patients need to think of you as a friend. They need to refer to you as a friend. How I normally say is this: if the patient tells a friend of theirs, hey, you know, well, right, go and see my friend in that clinic. then we have done the job. If the person says, go and see the doctor in the clinic, you're not there yet. Your aim should be every patient that walks into the doctor, every patient, even the FOMEMA patient, even the pre-employment patient. From that first visit, you need to be as sticky as super glue. And I can tell you, they will not go anywhere else. Okay, I've got 32 seconds left. Time flies, isn't it? Anyway, I think I just want to end with this. Okay? Of course, feel free to ask me later if you want more specifics. But I want to end with this. Because we see a lot of young doctors today, they want to get rich quick. Today I see this burgeoning of concept, grow fast, sell fast, get rich fast. I see a lot of practices where investors lah, tak kisahlah celebrity ke, orang kaya mana ke, they offer duit with the hope of going for IPO. Equity crowdfunding, ECF. Wah, doktor sekarang dahsyat, macam-macam jenis dia tahu dah dia boleh jadi private equity firm dah. But let me tell you one thing, there is no shortcut. There is no shortcut in GP clinical practice. The only way for you to be sustainable and profitable is if you are consistent. I can see some familiar faces here. You can ask people like Dr. Patrick over there. He's gone again. Hey, he's still there. Hiding behind the phone. Yeah. Huh? Some of you senior doctors, maybe you can also share. But it's very important. Being consistent, being honest, is exactly what private GP practice is all about. So with that, thank you very much.
Ladies and gentlemen, please put your hands together. Make some noise for Dr. Junaidi. Now, we do have some questions from the floor. Do we have any questions from the floor? We're going to put our Slido QR code on screen. For those of you who have any questions and so on, you can screenshot the QR code and your questions will follow up. Let's erase these other first four questions. We can get that done. From the floor? Any questions from the floor, or you want to scan up here? Not to worry, Dr. Junaidi will be around the conference this whole next 2 days. Thank you so much, Dr. Jun. Thank you. Thank you, thank you. Give him a big round of applause, ladies and gentlemen. Susah nak buka klinik pun. Now a lot of things are happening.